So I'm going to go ahead and share my screen right now and just get us going. And again, I'm going to let Chantel monitor our chat. There we go. Whoops, no, let me go back up. I wanted it from the beginning. It doesn't go from the beginning. You know, I get better each time. So welcome everybody to our Canuck Place Connect session. This is our second session in a series of 4, what may be quite a few more as we go through. And it's really meant to be an opportunity to connect all of you as supporters and volunteers and people who are engaged with Canuck Place in what's happening for us right now as we've adapted with COVID. So this is me, once I get this going, Karina Chow. Just so you know, my superpower is enthusiasm. Hopefully that's coming through. My weaknesses are coffee and chocolate, and my email is right there, and my phone if you are interested in connecting with us or with me, with us, after this session. And then my co-host this morning is Chantel Bowles, and her superpower is a bubbly personality and the ability to make a decent meal out of just about anything in the fridge, and her weakness is kittens and pizza. I do want to begin by acknowledging that the land on which we gather is the unceded territory of the Coast Salish peoples, including the territories of the Musqueam, Squamish, Tsleil-Waututh, and Stolo nations. So before I get going, really want to bring it back. Our mission is to provide innovative, holistic care to children and families with life-limiting conditions across the province. And we do that in a variety of ways. Today, we're going to talk about respite care with Kirsten Campbell. But the way we're able to do that is with all of your support. We have amazing government partners who are there to help us. And then we also have our huge donor community that helps and comes in and provides about half of our funding each year. So we are grateful to all of you. We are so grateful to all of our volunteers who just create a beautiful environment for our families when they're in-house. Canuck Place Care. So really one of the main focuses of our care is to provide the best quality of life care for every child. And we do that by providing real choices, a choice for the place of care, a choice for the place of end of life, and a choice for emotional and bereavement support. So it is my pleasure at this time to introduce Kirsten Campbell. Kirsten is a clinical nurse specialist who has worked with Canuck Place for, I think it's almost 6 years. Is it 6 years? Give me a thumbs up, Kirsten.
Just over 6.
Just over 6 years, based at our Dave Letty House location. And her superpower, and I can totally agree with this, is infusing joy into the day. And her weaknesses are wine gums and mini eggs. So now you know just a little bit more about Kirsten. And I'm just going to let her take over and talk about Canuck Place Care.
Hi, everyone. So today I wanted to focus about respite care specifically in COVID times. And I have created, I've put some thoughts into kind of what I wanted to share, but please add to chat and Chantel can wave at me and interrupt because I want this to be applicable and answer any questions that you guys might have based on your thoughts coming in today. So many things have changed drastically over these last few months, as we all know. But what hasn't changed actually is pediatric palliative care. Infants, children, and youth are still struggling with life-threatening conditions. So what an opportunity for Canuck Place to live into our established values. So our clinical team is here, as always, providing expert, compassionate care. So I thought I would kind of describe respite at Canuck Place during COVID-19 in light of how we are embracing our organizational values right now. So you'll see in front of you the shared screen is kind of living out our values. So I'm going to kind of walk through each of those values. So when I think about compassion and connection, we know the little things make the biggest difference in the lives of those around us. So while it's proven that children with COVID-19 right now experience less severe symptoms and we have lower mortality rates than other age groups, the negative impacts on these children, the youth, and their families as the result of this pandemic are significant. So we have the opportunity to meet the families right where they are at right now. Many of these families are finding themselves with decreasing support from nurses and caregivers in the community. Many, especially at the beginning, many of their caregivers were in self-isolation themselves, so they weren't able to go into the family homes. The closure of school has a huge impact on these families. Parents working from home has a huge impact as well, and it's really increased the burden on many families. So as we are able to ensure that our hospices are as healthy and safe as possible, we can offer relief to these families who are in need right now. I was thinking about one of the families that we've supported recently was reluctant at first to book respite during COVID. It's actually really vulnerable to expand your bubble. And these families work so hard on a daily basis to maintain their safety in their home. And yet the burden of care can feel pretty intense, especially in light of decreased resources in the home. So the mom of this child, a few days into the stay, she came in for a visit. And then she said, "My daughter is having the time of her life. I didn't realize the stress I was carrying at home and the impact it was having on her. I didn't realize just how much I needed respite." And we're actually finding that a lot, that families that are booking respite, suddenly they're calling in, they're saying, "Any way we can extend this? I didn't realize just how tired I was or how much stress I was holding right now." And it's really neat to kind of live into that right now. And during COVID time and in general, I always think the fun thing about respite as a nurse is that we get to provide more than what the family may be thinking they're coming for. So though it may be a physical break that the family's looking for from personal care, having a team of experts in-house provides that opportunity of that clinical lens to speak into the child. So what might just be a bath to someone, to us is an assessment and the opportunity to say, "Oh, I'm noticing something different." We have the ability to tweak things, to work on a care plan, and then to actually monitor what's going on while they're here. And then when they go home, they say, "Hey, we considered changing the feed a little bit like this way. We found that they responded better to this." And it's kind of that fun opportunity as nurses to provide great care. Through the relationships we build with the children and their families, we get to speak into these changes and engage in thoughtful conversations about goals of care and what's important to them. So that was kind of compassion and connection. Any questions, anything flagged so far? Thumbs up, no, okay. So our next value is embracing life. And we know that every moment counts in the journey with newborns, children, youth, and their families. So Karina, can you flip to that picture, the next slide? This picture shows one of my favorite spots at Dave Letty House. It's one of our alcoves, and Glen Brae in Vancouver has a similar setup as well. And although that picture is empty, that has not been the reality of the last few weeks. As we work to figure out social distancing within the workplace, this alcove has been filled with dance parties, music, and school sessions. Last week, I was sitting in my office, which is just down the hall from that alcove, and I could hear one of the kids talking so loudly, like talking, vocalizing. It was just loud, loud, loud. And intrigued, I wandered over, and he was doing school. He was on his iPad with his educational assistant, and he was talking, like he was letting them know how engaged he was in school. And it was just so encouraging to see him engage in that way. And his mom had said when she dropped him off, the burden she felt trying to help him with school, his siblings with school. She was also working from home, and she just felt like she wasn't able to give that. But here we were able to help set that up, and it was just such a great moment.
That brings wonderful memories of the early days of your opening, when I sat there and played the ukulele and attempted to sing. And since I haven't been able to volunteer since last June, thank you for taking me back to that lovely spot. I'll get back there again one of these days. 2 months since my knee replacement, and I'm walking much better.
Merle, I picture you in that spot playing that ukulele and singing, and it is such a joy. The first weekend we were open, I remember walking into the house, and there was parents in their pajamas drinking coffee and nurses holding kids, and there's just something incredible. It's like the living room of Canuck Place, and it's really special. Thank you for sharing that. And you can read, as I keep speaking, you can read the quote that was one of the families this week, again, just reiterating how grateful they were for respite right now. So the next value is quality and safety. And I won't say it has been easy to determine how to ensure safe quality care during a time of socialization, but I will say that there have been incredible steps taken to minimize the risks to the kids and the families who come to the hospice. In the early days, as you can imagine, information was changing daily, and our team had to kind of pivot daily or multiple times a day. and the information directions coming from Provincial Health Officer, Ministry of Health were ever changing, and keeping up with recommendations and directives was challenging. But the team has implemented social distancing guidelines promptly and effectively, and it's made a big difference. It mitigates risk and it maximizes safety for the kids, for the families, and for all the team members that are needing to be on site right now during these uncertain times. So there have been many steps taken to make Canuck Place a home away from home, where we are social distancing as a work family and providing care to our children and families. So we quickly implemented practice changes at both hospices, and we wanted to ensure we could keep physical distancing as recommended from Dr. Henry. This wasn't always possible when we work closely with children. So you will also see that when we're within the 6 feet from our children, you'll see our staff wearing the personal protective equipment as well. And we've increased our careful screening of team members, family members, as well as any visitor into the hospice. We very sadly, as you mentioned, Merle, and I know Helen, we've very sadly for now had to say farewell to all of our volunteers and many of our support staff working out of the hospices. But the more people who are able to work from home, the greater ability we have to socially distance at work and create this safe space. So we say thank you. And we are working closely with the families. There's been new intentionality or thought process into who is having respite right now. And so kind of based on the burden of needs and the care needs that are going on right now, we are kind of analyzing what those needs are. And in general, for respite admissions, we are encouraging parents and siblings to stay at home to decrease the footprints and increase social distance capabilities in-house. And obviously this changes for our end-of-life admissions. So the team is collaborating to support families in decisions that are important for them and finding safe ways for visits to happen as well for family members. And when there are families in-house, we're taking kind of additional safety steps like staggering meal times in the dining room area, only using private rooms for admissions. So next value, I don't know, Karina, you can switch back to the values if you want to, is the team. We collaborate with one another and our partners. So as a Canuck Place team, we are assessing the needs of our kids and families on our program, and we prioritize care based on that assessment. Families as well are making decisions about whether respite is helpful for them at this time. Some families have chosen to cancel their respite stay as it's easier to maintain their current practices at home, whereas other families are reaching out requesting additional respites. Collaborating as a team also means a lot of Zoom, Skype for business meetings, and virtual care. So many of our clinical team members are also working from home, from our counseling team, our intake team, the nurse managers, educator, professional practice leaders on a rotating basis. And I also think there's kind of this excitement lingering too about what opportunities there might be for virtual care to increase after COVID ends. And so what might this look like? I was gonna say, we feel the support of dropped off treats, words of encouragement, and the gratefulness that team members staying at home allow the frontline staff to provide the safest care possible to the kids and families of Canuck Place. So our last value is accountability to one another, to families, staff, volunteers, donors, and community. Canuck Place rapidly mobilized together with BC Children's Hospital to kind of prepare for what our role may look like in the healthcare system to care for our common population of medically complex and children with life-threatening conditions. As you can imagine, originally we were anticipating that there might be a surge in patients province-wide, and we were prepared to help as we could to ease the burden from Children's Hospital. And although BC has really worked to flatten the curve, we continue to screen children, families, and staff and anybody that enters the space so that families feel safe and stay healthy. And the benefit of not experiencing the anticipated surge is that we've had the ability to respond and provide respite to the kids and families who are expressing this as a need in these challenging days. Karina has spoken to this before, but Canuck Place vision is that all newborns, children, youth, and families living with progressive life-threatening conditions will benefit from our compassion, knowledge, and holistic clinical care and pediatric palliative care. And along with the current respite care, we are ramped up our virtual care for kids and families across the province. we are answering many phone calls from families as they think through their hopes and goals for their child in light of this pandemic. We are aware of the need to maintain our safe distance while also still ensuring we're providing that expert, compassionate care. So we're working to be accountable to safety, accountable to care. It means that home visits might be less and the phone or FaceTime might be increased, but we can do home visits with the use of our protective gear. So those are our values. And I think on behalf of the children and team members that are on site, we extend a big thank you to all those team members that are working away from their usual place of work, because we imagine that this is a tremendous change for you and a challenge too, and we are grateful. So volunteers, we miss you, and I want you to know we share stories about you. We're talking about you, we're infusing you into our days because it really matters and we see it. And we are anticipating the day when we are all back together, and we come together with the recognition that the support of our families, staff, volunteers, donors, and community is really what allows us to provide holistic clinical care with compassion. So I kind of like flew through those values, but that's really what I wanted to summarize in general about what Respite looks like right now. But I would love any specific questions or thoughts that you have coming into today.
Chantel? Oh, Chantel, are there any questions from the chat, or if you want to put your hand up using the functions at the bottom? Maybe I'll stop sharing and we can all look at each other. Ooh. I think, oh, okay.
I can speak to that.
Ellen,
so Ellen is asking, are we limited how many families are in at one time? So in a way, yes. So in Vancouver, there's different limitations. Obviously, the physical side of the hospice is smaller than Abbotsford, and they're wanting to ensure if there's family suites that families aren't sharing a common bathroom. And we're mostly limiting family members to the immediate family. And so sometimes we're doing some garden visits or outside for extended, and trying to hook people up with Zoom more. For end of life, obviously trying to make meaningful decisions that are most important. For Respite in Abbotsford right now, as much as possible, we're asking families to stay home if they're able to, because it just provides the least amount of footprints here. But obviously, they want to come for visits, and we're also trying to find safe ways that they can come in, and then we're providing daily screening. And there are times where it really is most serving for the family that someone is here. And so we've definitely had a couple family members that have stayed, and we do a daily screening of different symptoms to ensure that they're safe coming in here. We're doing temperature of families every day and temperature of any visitor coming into the home. We have a whole safety protocol for anyone that enters the home, and our staff are very clear about calling in for anything ahead of time if they have any symptoms, so not coming in. So we are decreasing family, but also trying to be really meaningful and purposeful, that if that's an important part of their care, how can we try to support that right now?
Kirsten, we have another question in here from Jennifer. How are you prioritizing the need of families needing respite?
Yeah, so it basically comes, most of our intake requests come to our intake nurses, and then they're connecting with the greater clinical team. So the managers, the medical director, and clinical director, and there's COVID meetings that are happening daily. So basically it's going to these meetings and they're having decisions about what are the essential needs right now, who has received respite already, who has not, what is our capability, what can we safely manage in the home right now, and what are the family stressors going on. And so it's just trying to analyze based on the needs that we see coming up.
How many children do you have generally in each of the houses?
It totally varies. Today at DLH, we're status quo. We have 4 kids here today, which is what we always have. And so typically the last couple of weeks, we've had between 2 to 4 children at DLH. Vancouver hasn't had as many respite, but they have had symptom management at end of life and some respite. So I think Vancouver right now can have up to 5 kids, and Abbotsford can have 4.
Because you're using only private rooms.
Exactly. Yeah. Fortunately, in Abbotsford, all of ours are private, so there's a different ability, and we're just having to be a bit thoughtful about what that looks like in Vancouver right now.
And parents can visit only for end-of-life care, or stay only for end-of-life care?
It's not that they can only stay, for sure. End-of-life care, that's a priority, and then it's based on conversations about what's most serving to the family for respite stays. And if there is the ability for them to stay home, it's those thoughtful talks about saying how we can decrease footprints and maintain socialization in the home. And if they do come, we're kind of keeping most rooms closed. And if the families are here, they're social isolating between their kids' room or with their kid and between the family suite. So it's not just like free for all going anywhere. We're still really working on trying to maintain that social distancing within the homes.
Last, what about the school? Is Kay using her iPad to connect with kids, or?
Yeah, Kay is doing a lot of incredible virtual work, as you can imagine. Kay is like powerhouse school teacher, and her and Bridie both are really connecting with families that are expressing. I think it went out to any family who needs help, that as if they're connecting in with Kay, she's trying to support them through like virtual ways.
I've had one question, but I don't, that I think I'll save to the end. But are there any other questions from the group for Kirsten? Don't be shy. You can even ask the question if you're not quite sure what respite is. Does everybody I'm going to make you do some work here. If you know how to use the reactions and you know what respite care is, give me a thumbs up. At the bottom, okay. Oh, still waiting. Good, good. Okay.
That's a good point, Karina. I kind of went on the assumption that we were not doing baseline respite care, but please, I'm happy to.
Well, and I think
that.
I've noticed that we just did have one. So you know what, Kirsten, I will throw it to you just to explain, because I realize it may not be completely clear in the context of Canuck Place.
Yeah.
What respite care looks like.
Yeah, so any child on our program, except in our program, can have 20 days of respite a year. And so that looks like them coming in and having a nurse and care aide and clinical team providing their full care. So they come in with all of their medications. They come in with a very extensive care plan that we review on admission. And the family can choose. Some love non-COVID land times. They love to be able to come in and be near their kid and get to spend time with them, but not have to provide that physical care. So families can choose to stay and be part of respite, or sometimes it's their ability to get away or have time to themselves, and so they stay home for that time of respite. But it's really a child coming in and having an expert team of care providing for their full medical, emotional, spiritual needs for that time period.
Awesome. We have had a question, what percentage of families do you serve outside of Metro Vancouver? And Denise, correct me if I get this wrong. I believe it's about 70% of our families come from the Lower Mainland. So that would be Coastal Health and Fraser Health collectively. I'm looking at her. Is her head nodding? Nod at me, Denise, if I've got that right. I'm in the ballpark. Yeah. And generally we do mirror general population statistics. So where you see the majority of families, which is the Fraser Valley, you see the majority of our families. So about 30% of our population, but again, we follow the same mandate as Children's Hospital, that we serve a family where the family is. So if there's a child who is eligible for our program, they come onto our program, we're providing support to them in what means that is most meaningful. And I'm going to throw to Denise to maybe, if you want to add to my comment there.
Sure. I think the number is just a wee bit higher. So when I look at our stats, it's about 77% of our children and families are outside of Vancouver or Vancouver Coastal Health. So we truly are a provincial organization, and I think that's important to note, Karina, what you said, that we are serving children and families in their home communities. I see MLAs on the call from across the province and across the Lower Mainland, and I know that Canuck Place is supporting children and families in your community. Kirsten, you talked a little bit about certainly the respite that's happening at Dave Levy House and at Glen Bray here in Vancouver, but I know there's been an increase in calls for our home-based support, both through our clinical team, our nursing team, also through our counseling team. So I think we're seeing an increase and an increase in our ability and our muscle to deliver care using the various technologies. I think we're all becoming Zoom masters in the past 8 weeks, whether we wanted to learn this skill or not. And it's been amazing to watch this team adapt how they can connect with families and keep those families safe and at home in their communities. As you said, we have a population that's a little bit higher risk, and it's really nice to see that we're adapting to serve and keep families in their home communities.
I was going to say one thing, and that's a benefit to us, is that we've always served the province. And so we've learned creative ways for years to connect with those local communities, because many times it's us connecting with actually the healthcare professionals themselves so that they're able to support the child who they're seeing. And the families are phoning us direct. So we're maintaining a lot of that and receiving more phone calls. And you're right, our counseling team, I know that Deborah is speaking, I think the next session, it has exploded for them in support for these families right now. They are doing so much work right now.
So I think, Mary, I'm trying to get back to your question. Oh, it's around volunteers. When would volunteers be able to return? I don't think we can answer that just now as we develop our plan. We're so grateful for Dr. Bonnie Henry and her phased approach to coming back. And I think we're working through that. I know Jessica's on this call as well. And I think I will flag for Jessica to get back to you. And then anybody else who has a question?
Yeah, I think there's a question from Michael Karina. I see a couple, and I want to make sure Helene was good.
Okay, so Mike, I never call you Michael. You're a Mike to me. So if you want to go ahead, do you need me to unmute you? I will unmute you.
There, I'm unmuted.
You're unmuted. You can talk.
A rarity. Kirsten, thank you for you and your team for the magnificent work you do and through even more challenging times. So, and thank you for taking time to provide us with the briefing. Karina, my question though, I thought more appropriately is for you, because you're kind of, amongst many other things, responsible for ensuring that Kirsten and others have the tools they need. How is fundraising going, and what do we need to prepare for looking ahead in terms of we've had the galas, and that's obviously helpful, but the fundraising effort takes place year round, and it's undoubtedly been a little more challenging without disclosing things you're not either in a position to, but I presume there is some challenges looming.
You know what, Mike? First, I'm going to say I am so grateful for our community, because people really care and they're reaching out and they're always connecting with us. And we're very aware of how people have been impacted. So where we've had so many people who've done, for example, golf tournaments for us and other corporate sponsors who've been impacted, they have tried to let us know, and they're looking at ways that they can mitigate. But absolutely, as we explore what's coming, in the future, we're still assessing, I guess you would say. I'm going to throw it to Denise, because she could speak to the whole province. But we are absolutely really looking at how do we meet the needs of our donors. And maybe that's my segue to you, Denise.
Thanks, Karina. Just for everyone who I have not had the chance to meet on the call, I'm the Chief Development Officer at Canuck Place. So living and breathing the money in and the money out at Canuck Place. Mike, thank you for raising what is a significant issue for us. Many of you know that we are funded in a unique partnership way with the province of BC. The province provides between 40 and 45% of our annual operating funds each year. Donors like you and I can make up the rest of the bucket. So when we look at our fundraising activities, anything that is affected where we bring large groups of people together, we have our Gift of Time Gala in Vancouver, we have our Gift of Love Gala in Abbotsford. We are the fortunate beneficiaries, as Karina said, of many golf tournaments and third-party events. All of that activity really has taken us. We've had to figure out new ways. I would say that the impact to our revenue, we're going to be down between 15 and 20%, and we are in the millions. So our ability to sustain this care for children and families across the province, I think we will be facing some challenges this year. We have reached out to our partners at the Ministry of Health for some emergency support there. we certainly are exploring all of the options that have been made available through the federal government. We have applied for the emergency wage subsidy. We are looking at how we apply for the $250 million bundle that was announced by the federal government to benefit charities. So we are looking at the mechanisms that can help us through this. We certainly have been supported and are turning to our local partners as well. The Vancouver Foundation has a community relief fund. Several large corporations have emergency COVID funding. So we're keeping an eye, and our team is incredibly active in reaching out. And likewise, as Karina said, we've had wonderful support from current donors who have just even letting us know that my gift is solid for this year. It gives us a sigh of relief. But I would say we are in the 2 million range of what will be a loss on the fundraising side, which is incredibly significant. Like I said, probably about 15 to 20% of our operating funds this year. So again, we are pulling the levers that we can in terms of the federal programs that are available. We are certainly asking our partners at the Ministry of Health to help us through this as well. And we'll be looking to our donors. Such a timely question. We just had our full fundraising team across the province gather on Monday morning. We'll be launching an integrated campaign a little bit later this year. So you'll see Canuck Place, like I say, pulling the levers that we can to help get us through the next year or 18 months, however we are going to be experiencing our new normal.
Thanks, Denise.
Thanks, Mike.
Thanks for asking, Mike. I'm just going to throw to Jessica, and then we are a wee bit over, and then I'll wrap it up for everybody. So Jessica, you wanted to answer the question regarding volunteers.
Yeah, thanks, Karina. I received another message about it, and I know it's really big on everyone's minds about when we can get volunteers back in the building. And Mary, great question. Around, does there need to be a specific number of cases per week that we're down to before we make those decisions? And I'm here to answer your question with, we truly don't know yet, Mary, and to everyone else wondering the same thing. We're just looking now at what these next phases mean to us in terms of a working environment and then a volunteer environment. I get to join in on a clinical meeting today, actually this afternoon, where we're going to start to ask the questions. What is the approach? What questions do we need to clarify? So we're not quite there yet in terms of being able to answer what the criteria will be, but just know that it is the hot topic of everyone's mind, and we're on it as best we can. And as soon as we have an update, we'll be sure to pass it on. So not the answer you're probably looking for, but I just wanted to speak to that truthfully as best I can, because I know what the question is out.
So I'm going to go ahead and, oh, sorry.
Could I ask a quick question? With fewer kids in the house, I'm wondering about staffing. Have you had to lay off nurses, and will we therefore have trouble in the future getting full staffing?
So far, there have not been layoffs of nurses. And so what we've done is we've created some frameworks for how to use time creatively. It's actually been quite full the last couple of weeks. And so our staffing model has been the same. It was the first 2 weeks that, as we were waiting to kind of provide resources to Children's Hospital and that uncertainty about respite would look like, we had some more staff at that point. But we've utilized that for some of the mandatory education stuff that should get done. Is like, we've made sure that this is the time that we're getting those things done. And there's some great resources. There's extra educational opportunities that normally cost money that are free right now that we're kind of engaging our staff in to use the time well. So we quickly developed kind of a framework for how to utilize that time. And right now, with the patient population going on and the numbers in-house, we're needing to have the same. But we're also asking that staff that are able, when we're overstaffed, is to use up bank time, stat time, vacation time. So people are taking days off as well. To use up some of that time as well right now.
Great question, Nita.
Well, can I quickly speak into you just asked about extending 20 days of the year.
Oh,
so
yeah.
I'll just say, it's not an official, we wouldn't be able to officially extend more than 20 days based on the ability to provide consistency for every child that was on our program. But always, we kind of have a priority 1 respite and priority 2. And priority 1 is the 20 days that you're guaranteed. And priority 2 is when there's extra time available, families can request. And so I say that's what we're seeing right now, is that families are calling and saying, hey, any R2 available? We're really feeling the need right now. And so as we're able to, a lot of this is actually additional respite for these families right now.
Awesome. people who aren't aware, I'm going to wrap it up because we're just at the tail end, but for people who aren't aware, we actually have 425 volunteers. So we have a lot of volunteers who help provide exceptional care. So I think we've said it now 6 times. We miss you. We're very lucky to have such a dedicated group. And it also, I think, is one of the things that makes Canuck Place Canuck Place. And if you're out there and you're like, how can I help Canuck Place? We are on social. Please share more about Canuck Place on Facebook, Twitter, and on Instagram. We would love to share, you know, if you're out there and you're missing coming in, this is an opportunity to talk about that, share about that. We will always need more volunteers, especially at our Abbotsford location as we go back to our normal programming. We have 2 more sessions coming up in our Canuck Place Connect series, maybe more after that. We'll see what as we go. But next week is actually grief with Counselor Deb Davidson. I know a lot of us have been dealing with feelings of grief. And so Deb's going to take us through just a conversation around what that looks like for our families, but also some tips and tricks that you can use in your own life. And then Karen Roberts, who is our music therapist, will be joining us on May 28th. So if you haven't signed up for these sessions, please feel free to do so. And then how can you help? If you are able, every donation counts. Spread it through your network. We are so proud of our program, so proud of what we are doing, and we would love to just have more people engaged and supporting Canuck Place as we go about providing really exceptional care, which I think you could tell from Kirsten's presentation. We're so dedicated to providing exceptional, compassionate care. And I think I work with this amazing team, and I want to ensure that they're supported in what they need to do. And and if you are feeling creative, we have the Canuck Place Dance Challenge taking place. So if you are on TikTok, you can TikTok and dance for Canuck Place. So we have some fantastic fundraisers that are taking place by people in the community and who want to ensure, again, how do we support Canuck Place? How do we get more support in the community? And this is a fun way to do it, especially if you took up TikTok or dancing while you were in self-isolation. And we are also sending out some weekly newsletters. So if you're interested in that, you can connect with Daisy Brown. And finally, thank you. These are 3 of our fantastic kids, and their messages ring true. Thank you. You rock. We love how you give. We love all of you as our supporters and truly appreciate everything that you have done. If you have any further questions, you're welcome to stay on the line. For people who have to head into their next meeting, feel free to go, but we'll open it up again to some further chat, and I will stop sharing. And again, just so appreciative of everybody's support and care in taking care of Canuck Place. So yeah. Thank you.
It's been wonderful to see everyone. Thank you so much for joining us this morning. As Karina said, any questions, you know where to find us. And we're so grateful for your support. Thank you. Thank you.
So nice to see you. Bye, everyone.
Bye.